Hello, everyone, and welcome back to another episode of 2-Minute Emergency. I am your host, Dr. Leslie Sharp, board-certified emergency physician, international speaker, best-selling author, and professional photographer. And I am here to teach you about emergency issues in the effort to keep you out of the emergency department. I thank you so much for joining me again today. And today's topic is actually part 2 of my series of your health and your diet. Today, I'm going to focus on something which is diabetes and your diet. But before I get into that, there's something that I must talk about. So I mentioned about a week ago about how to travel safely during Corona. So that said, I'm going to change what I said. As we know, the numbers here in this country are continuing to rise higher than they've ever risen before at faster and faster rates. I had planned to go home to see my family. I'm not doing it now. It is just not safe. Even if you think that you're not worried yourself about getting the virus, the chances of you getting it and then passing it on to someone else, at this time, it's just too great. It's not worth it to have even the potential of infecting other people. So the cautions that I gave before, I'll stick by them, but I think it's best at this time for none of us to travel. There's no reason for you to have to see your family close in person. You can go on, just like I'm here today, you can go on any of the outlets that'll help you stream live, be it your phone, be it your computer. That's the safest way to visit right now. All right, so let me get back to the topic of diabetes and your health. First of all, a lot of people think about diabetes as just high blood sugar, but they don't know much about it more than that. So the whole idea of diabetes is when your body, for whatever reason, either does not produce enough insulin or the insulin is not used properly to break down sugars in your body. So what happens is your body glucose increases and your body is not able to take that glucose, which is normally taken into your cells to be used as energy, that's not taken up. What happens is it stays around in your blood system and it affects all of your organs of your body. It affects your eyesight. It affects your kidneys. It affects your heart. All of these, it takes time. It affects your circulation. So I'm sure you've seen patients, or I guess I call them patients. You might not call them patients, but you've seen people who have lost their limbs secondary to diabetes. They've lost their eyesight. They have increased chances of having heart disease, heart attacks, because what happens is that increased blood sugar ends up causing damage to the blood vessels. And this compounds over time. And that's what happens. That's how you end up being affected. So today, I'd like to talk a little bit more about diabetes and your diet. One of the things to help lower that level of glucose in your body is to watch what you eat, specifically looking at carbohydrates. So carbohydrates turn into sugar in the body. That's what we metabolize them or break them down into. So people think of, okay, I'm not eating so much bread. I've cut down on my bread. Great, but there's so many other things that you have to take into mind. Things like rice, things like potatoes, corn, anything that's starchy. That said, whole grains, as I think I mentioned last week, are better than your processed, but still your body is going to turn them into sugar. Eating more protein, eating more vegetables, that's the way to keep your blood sugar well maintained. So one of the things you want to do is make sure that you don't have those spikes of blood sugar up and down through the day. That's causing more damage. The idea is to keep everything on an even keel. One way to do that is to look at the carbohydrates that you take in. I'm going to provide you at the end with a couple of links that are to the CDC, which will give you some clues as far as how much carbohydrates you should take in. Now, that said, I want you to consider you need to talk to your physician and or a dietitian to find out what is right for you as an individual. Each one of us is going to be different. And I'm not just talking about this for weight loss, remember. I am talking about to control your blood sugars over time. So there are actually 34 million Americans that have diabetes in this country. And 1 in 5 of them doesn't even know it. Can you imagine? You have this disease that can affect your life, but you're not even aware. So keep in mind regular visits to your physician, making sure you're getting your blood work. That's important for all of us to stay healthy. Another thing I was going to say is that you want to do food planning. I talked about food planning the other day, and that allows you to schedule exactly what you're going to eat throughout the day. And you can do it several days in advance, so you know what to even purchase from the store. And that way you're more assured of keeping that blood glucose level stable. So here are the things that I'm going to send to you. First of all, the first one is for diabetes, doing carb choices. So this is just a bit.ly link. This goes right to the CDC. I'm not spamming. I'm not taking your email addresses, nothing like that. But I want you to consider downloading this, and I'll try to put it, when I post this online, I'll put that in there as well for you to go, and these are diabetic carb choices. The second link I'm going to give you is for a carb count. Let's see. And that is a way of counting your carbohydrates to know exactly how much you're taking in each day. So the reason I brought this into mind is because this is actually diabetic or diabetes awareness month, the entire month of November. So let's focus on this for the next couple of days and see how we can help you stay healthy. Once again, I'm Dr. Leslie Sharp, board-certified emergency physician, and I am here to teach you about emergency topics to help keep you out of the emergency department. I look forward to seeing you again on Tuesday, and hopefully you'll be able to use some of the tips that I'm offering today, and you will stay healthy and safe until then. Take care.